Welcome to this short training video based on the HEE assessment strategy, which is available on the website. This video is about how trainee pharmacists can upload evidence using the Miscellaneous Evidence form to demonstrate that they are meeting the GPhC learning outcomes through completion of the assessment activities outlined in the assessment strategy. There are several forms that will be built into the ePortfolio platform, which trainees can use to document assessment activities, such as supervised learning events. Separate videos have been developed to go through this in detail. The Miscellaneous Evidence form can be used to provide evidence for activities and documents that do not fit into the forms built into the ePortfolio, such as training or competency logs. It may also be used to record an agreed supplementary activity that provides evidence for specific learning outcomes that are more difficult to demonstrate using other assessment activities. The use of this form may vary between sectors, organisations and regions of training and should be discussed with the designated supervisor. Here are some examples of supplementary activities that may be suitable for a miscellaneous evidence form. This is an example of the miscellaneous evidence form and what it will contain. It is important to note that the form will look slightly different in the ePortfolio, but the fields will remain the same. In this example, the trainee has completed a series of dispensing logs to demonstrate that they are competent to dispense a variety of medicines. The number of items and the dispensing logs will be specific to the organisation, and individual logs do not need to be uploaded. The trainee may, however, wish to upload a certificate or confirmation of evidence. The trainee will need to enter the date when the evidence is uploaded, along with a description of the activity and a brief summary of what the evidence relates to. The trainee will reflect on the activity that they have completed. In this case, the trainee will need to think about what went well with their dispensing logs and what they may need to improve in the future. The trainee will also consider which of the GPhC learning outcomes the activity provides evidence for. The suggestions on the slide are based on the Trainee Pharmacist Foundation Year Assessment Activities Guide that can be found on the HEE website. The practice or designated supervisor will then provide feedback to the trainee and discuss where they performed well and which areas they may need to focus on next. The trainee will have the opportunity to develop actions from their own reflections as well as via the feedback they have received. Once the miscellaneous evidence form has been completed, the trainee will submit it to their designated supervisor for sign-off. This will include confirmation that the learning outcomes indicated by the trainee have been met at the required level for the foundation training year. For further information on the learning outcomes, please visit the HEE Trainee Pharmacist Foundation Year Assessment Guide and Strategy on the HEE website. There are also suggested activities for each of the learning outcomes and also many other additional resources. For more information, particularly on the learning outcomes, please do look at the GPhC Foundation Training Manual on the GPhC website.